So I'll be quickly talking about the zones of the neck. All right. So I actually got to know about the zones of the neck even during my anatomy classes. I didn't know about the zones of the neck. All right. I got to know about the zones of the neck when I went for a call. That's a hospital call in the evening. So when I went there, a guy actually had a stab on the neck. Okay. So I had the doctors on call discussing that. Okay, this stab is in the zone 2 and all the stuff. So I didn't know it. So I just wrote it down that I'll come and do a research on it. Right. So the zones of the neck. So we said that this human neck is actually divided into three zones. Right. And this division was done because of surgical, traumatic, and radiological purposes. Okay. They didn't just divide it for dividing sake. All right. They did it so that what if you know that there's an injury in zone 1, you know how to go about managing it. If you know that there's an injury in zone 2, you know how to go about managing it and all that. All right. So now these zones help to guide management and treatment. Right. So starting with the zone 1, which is down here. Okay. Let's define it. We say that zone 1 actually includes the thoracic duct, the esophagus, the trachea, and major vessels. All right. So you can see right here that what major vessels will be here. Of course, major vessels will be in zone 1. Okay. So surgery and treatment at this zone is challenging due to what limited access. All right. Then we have the zone 2, which is also known as the mid neck. Zone 2, which is between what the clavicle and the hyoid bones. So this is what at the level of the clavicle, all right, and the level of the hyoid bones, all right. Let's define zone 2. So that zone 2 is the most common zone of the neck trauma and surgical interventions, all right. It includes structures like the larynx, pharynx, carotid arteries, and the rest. There's a relatively easier access for surgery and treatment, all right. So I could see that they actually quickly treated that boy that had a stab on the neck, all right, because it was in zone 2. If it's in zone 1, it is much more deadly. Then talking about the zone 3, which is much up there, right? So zone 3 actually includes the core base, the pharynx, and the larynx. Surgery and treatment can be complex due to what it is due to what its closeness or proximity to what vital structures. All right. So now these zones actually help clinicians to assess injury severity. It also helps them to actually what plan for surgical approaches. Right. Uh, get them ready on which type of surgeries to do and all that. It also guides what radiological investigations, right? Also determine treatment strategies. If you have different options for treatment, then these different options will apply differently, okay, in different zones of the neck. All right. So that's it about the zones of the neck. You guys, soon.